Sometimes it is suffering from breathing difficulty or regurgitation, chest burning sensation or pain due to high intensity work or heavy meals. Heavy work after meals or during sleep. It is maybe due to myocardial ischemia, which refers to a coronary artery present in the heart, supplying blood to the myocardial layer, that is heart muscle perfusion, which is get affected or occluded due to some atherosclerosis or occlusions present in the coronary arteries, which leads to myocardial ischemia. The seminar class is about myocardial ischemia. Our students will explain about what is myocardial ischemia and its definition, causes and diagnostic procedure and how it will be managed.
Let me tell about the definition of the myocardial infarction, which is commonly called a heart attack. It is a irreversible death, necrosis of the heart muscles due to the prolonged reduction or complete blockage of the blood supply to the myocardium. It usually occurs because of the sudden obstruction of a coronary artery by the thrombus, which is formed over a ruptured atherosclerotic plaque. Let me see about the pathophysiology of the myocardial infarction.
So here the myocardial infarction, which is refers to necrosis of myocardial layer of heart, that is myocardial layer blood supply get occluded suddenly due to rupture of thrombosis, which is yearly presented in the coronary arteries, which get occluded in certain area, which will cause inadequate or poor or a sudden stoppage of blood flow through the myocardial layer, which will lead to the death of myocardial muscle, which is called as myocardial infarction, that is necrosis, which will in turn cause the sudden heart attack. Okay, let's see about pathophysiology.
A Doppler echo assessment of MI, which is a non-invasive tool for assessing the myocardial infarction, which is evaluating the regional wall motion abnormalities in LV and ejection fraction. Here, which will estimate the LV ejection fraction, a reduced LV, often which is indicate a larger or significant infraction. And here to assess the specific segment of heart wall for the akinesia and dyskinesia, which is already corresponded to the supply of blocked coronary arteries and transmural flow, that is tissue flow that is also measured using tissue Doppler to evaluate the LV filling pressures and restrictive filling pattern, and which is indicating the severe diastolic dysfunction and correlate with the proper prognosis. And then myocardial performance index, that is MPA, it is also known as TI index. This is a Doppler measurement that combined with the systolic and both diastolic time interval, which is act as very powerful predictor of mortality and failure, that is a heart failure due to post-MI, and which also evaluate the deformation of myocardium to quantify the regional valve functions, providing the deeper insight, and then standard velocity measurement, and also helpful for hemodynamic profiling. Assess the severity of MI by non-invasively estimating the pulmonary capillary wedge pressure, that is PCWB, using the pulmonary venous flow and mitral annular velocity, and mechanical complications like Doppler.
Pathophysiology. Let's see about the pathophysiology. There are certain conditions which causes the myocardial infarction. Number 1, atherosclerotic plaque formation, which is fat, cholesterol and inflammatory cells which is accumulated in the coronary arteries, forming an atherosclerotic plaque.
So the plaque is because of presence of some cholesterol or fat deposited in the which layer? Okay. So which is get accumulated in coronary artery and forming the atherosclerotic plaque. Then second one is plaque rupture.
Plaque rupture. The plaque ruptures or erodes or exposes the thrombogenic material.
Okay, it is exposing like thrombogenic material and later it forms thrombus, that is a platelet aggregate and blood clot form from the clot rapidly. Then it will lead to what? Coronary artery occlusions. Yes, coronary artery occlusions are
coronary artery occlusion. The thrombus partially or completely blocks the coronary blood flow.
Okay.
Number 5, myocardial ischemia.
So blockage which is leads to the myocardial ischemia, that is reduced oxygen supply or poor adequate blood supply, which will cause the ischemia of cardiac muscles. Then later it will leads to myocardial necrosis.
Late ischemia starts